So one of the key pieces when we were tapped as one of the initial vaccination sites that we anticipated was how are we actually going to be able to manage all of those requests for appointments and do so in a concerted fashion. And leveraging the Verto tool really allowed us to do so. We didn't have to set up a call center, which we anticipated from others to be able to receive calls from clients looking to be vaccinated. We also recognized we had a very short period of time to actually implement, so less than a week in order to get up and running. And we were able to do so, get that set up with the appropriate time slots available so we could hit the ground running before we had to actually launch our clinic. We avoided manual appointment booking as mentioned, and we're able to actually put this in the hands of our long-term care home partners and our own internal staff when we were vaccinating, which was actually very helpful. A lot of the information you're collecting is related to the client's personal information, and having to get that over the phone, you can imagine having to confirm health card numbers, email addresses is a bit of a challenge. So alleviated a lot of those issues. And then the one key piece would be just recognizing the number of people we had to vaccinate and the short amount of supply we did have when we first launched. Being able to manage that and having people wait on phones and leave voicemails or emails and being able to get back to them in a timely manner as we were pushed to actually vaccinate as quickly as possible would have been a big challenge that we were able to avoid. Next slide, Jim. Thanks. So as mentioned, we were able to deploy this quickly, actually in less than a week. So when we found out we were launching our clinic, we had less than a week to do so, and we had to get the Verto tool actually up and running so that people could book for that first vaccination day. So we were able to mobilize quite quickly. We were able to actually allow staff to go in and book their appointments themselves. And this was both for our long-term care partners and our own internal staff, and able to collect that information at the time as well. This really helped because staff were able to book times that were convenient for them and see what was available. At the time of booking as well, it was able to send out appointment reminders and confirmation. And we actually included within those appointment reminders and confirmation information about the vaccine, the consent form, information about when to arrive at the clinic, directions to the clinic. This helped alleviate a lot of issues around people not having the right information, actually helped us expedite flow in the clinic as everyone did show up with their consent already reviewed and kind of completed. As well, we were able to auto book the second dose appointment 21 days out. I think, unfortunately, we had to change that due to vaccine supply, but Verto was able to help with that as well. But it was good to be able to have someone's second dose appointment automatically booked and not having to put additional resources to look at that second dose booking. And then again, one of the key pieces was importing this information into the ministry COVAX tool. It's a lot of information that they were asking us to import and still asking us to import. The Verto tool allowed us to pull those exports real time and be able to upload that. So we got to the point where we were uploading, and we still are, uploading that information directly into COVAX the morning of our clinics. So we have the most up-to-date information of who's coming into the clinic the day of. And being able to upload that into COVAX to help support the check-in process. So that's a high level, some of the key pieces that the Verto solution was actually able to help us achieve. And this was as soon as we launched our vaccine clinic back in December.
That's great, Giuseppe. Thank you for that. And when you guys book your second dose appointment, are you booking that at the time the person books the first appointment? Or are you waiting for them to actually arrive at the clinic for the first appointment to kind of cut down on the no-shows?
Yeah, that's a really good point. We actually don't book that second dose appointment until the client is actually checked out. So anyone that is a no-show doesn't actually get their second dose appointment until they actually have their first, which is a good piece because it alleviates the need to have to reschedule or identify who those no-shows were when you're booking your second dose appointment. So it's quite good. You have to move through the full process for your first dose before you actually get your second dose appointment.